Hello everyone, welcome back. So we have already started with our chapter number 2, that is role of government in health. So today we will start with another part of the chapter, that is public and private healthcare services. So we will understand the difference between public health services and private health facilities or services. So public, first we'll start with the public one. Public is also called government. Okay, so it is a chain of hospital and healthcare center that is run by the government. They cover both rural and urban areas. Second reason why it is called public, because the money that is incurred in order to set up a hospital and provide healthcare facility is by the taxes which the public pay. Okay, it provides free or low cost facility, the treatment. And when you talk about the private healthcare system, they are not owned by the government, but the government can give them directions. People has to pay for every facility. Okay, so apart from these, you can see the differences here. These are the differences. Can you see? So first of private hospital is they are neat and clean. The doctors are well educated. They have better equipments. The doctors, nurses, staff and are soft spoken and caring. The ambulance arrives on time. The cost of treatment is high. Many tests are done here. They prescribe expensive medicines. And in public or government hospitals, they are not neat and clean. The ambulance does not arrive on time. The indifferent attitude of doctors, nurses and staff. The cost of treatment is low. They prescribe generic medicines. So which are the generic medicines? They are loose kind of medicines which the doctor will put in an envelope and give you in a brown envelope. They are generic medicines. And but in private hospitals, they will always give you expensive medicines which come in proper packaging. Fine, these are the basic differences, and underline all these important lines. Now go to this page number 26. So it's written here that according to our constitution, it is the primary duty of the government to ensure the welfare of the people and provide healthcare facilities to all. The government must safeguard the right to life of every person. Fine. Now next page number 27, you will see another topic, that is adequate healthcare available to all. So there are some points which you have to understand. The question this paragraph is talking about, that do you think that everyone means both rich and poor, do you think everyone is getting this facility, this healthcare facility? Is there equality? So there are a lot of things where we can say that no, it is not available to everyone. So first if you see, you will come to know that private services are concentrated in urban areas. So people who live in rural areas, it is very difficult for them to come to the urban areas and get treatment. The cost of treatment is always high in a private hospital, and the medicines are also expensive in private hospitals. So what about the poor people? They cannot afford it, right? And during the time of treatment, we always prefer to go to a private hospital. The reason is that they take good care of us and they give us proper treatment, but the cost is very high. So think about those poor people who cannot afford these facilities. And but in case if they have to take the treatment from a government from a private hospital, they take loan, and this causes lot of anxiety to them, a lot of problems to them. And the facilities in public hospital is not so good, and moreover the way doctors and nurses talk, they are very rude. Public services are mainly found in urban areas. Fine. Public services are also mainly found in urban areas, and in rural areas we have few health center and they do not run properly. Sometimes people do not take illness seriously. At many places, women's health is considered of less important. In some families, in some places, people don't give much attention to the female in their homes. So what can be done? Definitely it is the job of the government. So government should work on it. So it is the responsibility of the government to provide equality, to provide good healthcare services to all its citizens, especially the poor, right? So next page, there are two examples, the Kerala experience and the Costa Rican approach. So in Kerala experience, it says that in 1996, Kerala government gave 40% of its budget to the panchayat. and the panchayat used this money to work on water supply, schools, anganwadis and health cares, and all of these improve the situation of healthcare. Another is Costa Rican approach. Here what happened, the government, they decided that they will not have any army, and instead of army, whatever money they used to spend on army, they started to spend that money on the education, health and other needs of people, and in this way it improved the health services of the people, and government pays a lot of attention to health services. So this has improved their quality of health. Fine. So with this we come with the end of the chapter. Here you will find glossary, so pay attention to the glossary, learn them, write them in your copy. And let's go back. There are some questions in your book which I want you to do it in your copy. First question, this one: where do you go when you are ill? Are there any problems that you face? So here you will just write your own example. This is an example, don't have to copy this exactly, it is just an example. So you can say, yes, when I am ill, where do you go? If you go to a private hospital, then write down the name of the hospital, what are the problems you face there, what are the good things you see there. So all those things, whatever you face, you can note down. Another is this question: in what way is the public health system meant for everyone? So definitely it is meant for everyone because it is run by the government. So as the system is run by the government, it is meant for everyone. It provides free healthcare services to everyone, right? And here one more question you will find: private health facilities can mean many things. So it is talking about private. So in private you can say about two things: one, it is a social service, and another, it is a business, they want to make profit. That is why it is very expensive, right? So this is for today. With this we come to an end of the chapter. So revise the chapter, stay safe at home and do your study. Thank you.